Did you know that was part of the job when you signed up?
I did not. I was surprised.
But it didn't bother you?
Yeah, so, I mean, it's not something I want to do.
You've had your fingers in a lot of booty holes.
No, it's not a lot.
No, just... On today's episode of Careers Over Beers, I have with me Jared Smarsh, a dear old friend, and he is a nurse. And we're drinking Corona Premier because that's what he likes to drink, apparently. Is that right?
Yeah, when I'm classy. 90 calories, 2.6 carbs.
You think these are classy?
Oh, yeah.
Why? I've never thought of Corona as a classy beer.
It's an import, so.
Yeah, I guess if that's what you consider classy, everybody's got their own definition. So squeeze the lime, that's the best way to do this?
Oh, yeah.
Why do you like Premier better than regular Corona?
Just because it's, I don't know. I just like it better. I don't know. I like Corona regular too, Corona Extra, Corona Light. It's all good, but
This is how you do this. Stick that bitch in there.
this is like just a light beer style on it. So
It's like Corona Light.
yeah, exactly, except lighter and more Premier.
Well, Premier Man, tell us what you do for a living.
I'm a registered nurse.
Registered nurse.
Yep.
RN.
Yep.
That's what they call that.
Yep.
Well, cheers, brother.
Oh yeah.
Tastes just like Corona.
Yep.
Good stuff. Gotta have the lime though. You know,
Absolutely.
Corona's good on its own, but the lime just makes it.
Helps the skunk out a little bit.
Do you drink the lime in the Corona for the health benefits?
Yes.
That seems like something a nurse would do.
Yep. Just for the health benefits. It helps complement the taste, so it gets to your stomach without producing emesis, which would be vomit, of course.
Oh, emesis means vomit?
Yep.
I didn't know that.
Yep. That's the term we use.
Alcohol causes a lot of emesis.
It does. It does.
So the lime prevents that.
For me, I guess.
Okay, right on. So you're a registered nurse.
Mm-hmm.
What made you go that route?
Well, as every all-knowing 18-year-old, they tell you, you got to decide what you want to do for the rest of your life when you've never really done anything yet. So
That's such a weird thing to force on an 18-year-old. Like, figure out what you want to do for the next 50 years.
yeah. So I just looked at people I'm similar to, like my mom, and my dad. I think I would have been okay as a teacher. I just chose nurse because I always liked biology, seeing how the body works, stuff like that.
You were one of those kids in school.
Yeah, not math, just
dissecting animals.
I think it's cool to see how the body works, how it interacts with other parts of the body. So I was like, I'll go into nursing, end up liking it. So here we are.
That's a good thing, putting that to use. I mean, most people that aren't in the medical industry don't really like seeing how the body functions on the inside, unless they're a serial killer.
Yeah.
So it's good you went the medical route and
Yes.
not the serial killer route.
Yep. Yep. So and you understand kind of why, helps you understand things, everyday things sometimes, why you do the things you do, or why things are bad for you, or why one thing causes another thing in your body. So it's just kind of cool. It's not necessary. Obviously there's a lot of people that get through life without any knowledge of that, but it's kind of cool, I think. So
Yeah, it's definitely helpful knowing the whole anatomy of the body and what affects what, the things you eat, the things you drink.
a very superficial layer of knowledge I should add as well.
As a nurse?
Just maybe not just nurse, but as my knowledge. I mean, it can go way lower, obviously.
Well, it's like a lot of career fields. You can go down any rabbit hole and
Yeah.
specialize in any different subject, but
a broad knowledge I should add, I guess.
so as a nurse, you need to know quite a bit about the human body, but what's your main role, I guess, in a hospital?
So we work with, part of the interdisciplinary team, as we call it, doctors, nurses, therapists, like meaning physical and occupational, speech therapists, respiratory therapists, everybody, the techs that are part of it, everybody works together, try to carry out care for a patient. Usually you have doctors that give you orders, and the main objective of the nurse is to kind of be a little bit of a proofread on the orders. You always want multiple eyes looking at things, make sure you're not doing the wrong thing, and then to carry out the orders, and then kind of be an advocate for a patient as well. It's kind of you're the one that's there with the patient all day or all week or however long you take care of them, or depending on what setting you are as a nurse. You're kind of the boots on the ground, as you would say.
And the doctors are the commanding officer.
Yep, yep, right there. So they there's a lot of things that we need a doctor's order to do, and it's all some things simple, but it still takes a doctor's order, which is probably the safest way to do things, I think.
So you're not allowed to make decisions on a patient's health care at all.
Up to a certain extent, you can make decisions, but deciding if they get a medication or don't get a medication, or if they get surgery or don't get surgery, or anything like that. No, not up to the nurses.
Yeah. So certain medications, you guys are actually deciding if they need those or not?
No, I mean, you can, like, any medication that you give has gone through a doctor to get that doctor order.
Yeah. That's what I thought. So the doctor prescribes it, and then you guys just administer it to the patient.
Yeah, and they can do, they set parameters. Like, if you're looking for a certain blood pressure, you don't have to give it until it gets up or down to a certain blood pressure, and then you do it. So you have you have to pay attention to things like that. It's not just they get a Tylenol at 4 o'clock and a Tylenol at 6 o'clock and a Claritin at 10 o'clock.
And the rest of the time you just get to drink coffee and hang out.
Look at your phone. Yeah.
So you got to be on the patient all the time. I mean, you got to be on top of your game.
Yeah, I mean, depending on how sick the patient is, which in the area I work in, generally they're pretty sick. There's a lot of times where you get up and you go make a change on a medication, you sit back down, and you get right back up and go make a change on a different medication, or sometimes you have eight or nine different IV pumps just on one patient, where stuff's constantly running out, constantly watching, blood pressure, temperature, stuff like that
And how many patients do you normally have?
Two or three.
2 or 3 during one shift?
Yeah. Yep. We like to have just 2, because then obviously you can pay more attention, focus more, and you don't, it's safer.
Yeah.
In the real world, you have 3 sometimes too. So you just gotta.
I'm sure nobody out there likes having more patients.
You just gotta prioritize what needs to be done first.
So you show up to work, and these patients are already there, probably, obviously, and you're handed off by another nurse, and they kind of give you an overview. How does that work?
Yep. Report. So we get there at 7. Our shift is from 7 to 7, and vice versa. Night shift is 7 to 7. So the oncoming shift, clocks in at 7, but then you have to do report, which, generally takes 30 to 45 minutes. Can be, up to an hour or longer, depending on, what the situation is, how many patients, how sick the patients are. But you get there, you clock in, and you go to a huddle in the back, and a few general things. Hey, this week this is going on, or get your flu shots, or get your you can get your COVID vaccine, or whatever it might is. Just a few minutes of a general overview, and then you go out and start getting report about 7:05, 7:10, and that usually lasts up to about 7:45 or so, and then you just start. You get I usually sit there from about 7:45 to 8 o'clock and kind of make my list, look at everybody's stuff that's got going on today and everything, and look at all the orders, and then just kind of start making a list, and then you just prioritize and do what needs to be done first. You never really, you're never gonna be ahead of schedule because there's stuff to do all day long, but you keep up.
So you're busy the whole shift.
Usually, yeah.
12-hour shift, 7 to 7.
Yeah.
Is that how it is, you think, in most hospitals?
I think in the ICU setting, in the trauma ICU setting, surgical ICU setting, it's generally pretty busy.
Oh, okay. So you're in the trauma ICU?
Yeah, trauma surgical ICU.
Trauma surgical ICU.
Yeah.
So there's different sections of the hospital than you can be a nurse in. You don't have to be in that one.
No. So we have we have the trauma surgical ICU, which is where I work. We have cardiothoracic ICU, which does they take care of open heart patients. The coronary ICU, which is where heart attacks and heart caths and stuff go. And then there's the neuro ICU, which is obviously strokes, anything dealing with the brain besides a head trauma that still comes to us. Then you have the burn ICU, the peds ICU, and then the medical ICU, which is kind of general medical problems.
Do you get to choose which one of those you want to go to, or do they kind of choose for you?
You can apply to those jobs, to any jobs.
So it's just a different section you apply in?
Yeah.
Oh, okay.
Yep.
And that's
then
interesting.
All the floors. Yep.
So you applied for trauma surgical ICU?
Yeah. Yep.
Why did you do that? That sounds like the darkest one out of all of those. Well, maybe not the burn. That one might be pretty messed up.
Yeah, that one's tough. It's real hot over there, and I'm generally run hot. So that one was off.
You wanted a cool place.
That one was off the table from the beginning. But yeah.
Why is it hot?
Because like when you lose layers of skin, you can't thermoregulate. So they have to keep it pretty warm in the whole area.
Man,
so
that would be horrible.
Yeah. So, and we're right next to surgery where it has to be really cold in surgery because, to help germs. So it fits me a little better. So it's generally, I like to crank down the AC right when I get there to as low, 68 is as low as it goes. So I bring it down to that.
Is it comforting for the burn victims to be in that warm environment, or are they like, I'm burning up still?
I think that it's probably good for them. I don't take care of them very often. I go over there every now and again, but
yeah.
But I would assume it's probably, even if it's not comfortable, they probably have to have it, and no matter what.
Yeah.
So.
Wow. Can't imagine that, man. Trauma surgical, though, that's got to be some pretty hairy stuff you see.
Yeah. Sometimes.
So somebody gets shot in the head or whatever, they're coming to you if they're still alive.
Yep. Depending, they might get into the trauma bay and maybe they do a scan and they take them straight to the OR and see if they can, help something, fix something.
Yeah.
Generally, they'll come up to us after that, or straight from the trauma bay down in the ER. And then, those are some fun ones to take care of. Fun, meaning, obviously what's happened to them has happened to them, and now it's your job to help try to save them. Now, you never want anything like that to happen to anybody.
I would hope not.
But it keeps you busy, makes the time go fast, and it's not every day you get to see stuff like that. So, or anybody gets to see stuff like that.
No, most people don't. Most people wouldn't want to see stuff like that, but I guess it just takes a certain type of person, and you're in the right place if that's what you enjoy.
Yep, got a few.
I mean, not enjoy, but I mean, if you can handle it.
Yeah. And it's fun, with somebody that's so sick that there's a lot of things going wrong, trying to, figure out the mystery, trying to make the blocks fit, the square peg in the round hole or whatever it might be, trying to figure out the problem and help everybody figure out the problem. So
if they have a round bullet hole, you try to squeeze a square peg through that? What's the craziest injury you've ever seen?
Wow. There's a couple. Obviously there's a bunch of gunshots and stuff like that. I think maybe sometimes what comes along with the injuries, kind of what happens, because one guy got shot in his shoulder. And he was super sick. I think he might have coded in the ambulance or whatever by the time he got.
What does coded mean?
His heart stopped, didn't have a pulse, so they did CPR. By the time he got back to the trauma bay, they actually did what's called a clamshell thoracotomy on him. So they cut you open kind of like a clam. So whole chest cavity's open.
Ooh.
Pretty much, and the heart's right there, and you massage the heart to get it going.
So they cut
again.
you how far down?
This way.
Oh, they cut you this way.
Yeah.
And they pull you open like this?
Yeah, kind of like that. So.
What do they cut you with?
Scissors. Yeah, bone saw, obviously. But
so they cut your flesh with scissors?
Well, they can cut you really like any way. They cut you open to get to your heart.
Have you been there right when they cut somebody open?
No, I haven't. No, but I've heard about it. I've heard
it's insane?
Yeah, and so that guy actually lived, but
they had to massage the heart. Why do they do that?
To got to get it going again. So
they massage it.
Yep, kind of get it re-going, and you can.
Why does that? Don't they have other methods to get it going?
Yeah, but you don't. A common misconception is that if somebody's heart is stopped, that you just shock them.
Yeah.
But asystole, which would be like a flat line, it's not a shockable rhythm. You don't shock somebody who doesn't have any heart movement. It's like you have to try to get like V-fib or V-tac, something like that. That's a shockable rhythm. You can't just start shocking dead people and expect him to come back alive. Yeah.
Really?
Yeah.
So when you see people, so in the movies, sometimes somebody will just be out, gone, and they go, brush, brush, and they come back. That doesn't work unless their heart is actually beating in some form still.
Yeah. So you don't like all the protocols, everything like that. If there's no pulse and no heart activity, you do CPR. And until you can get a pulse or some type of heart rhythm that you can shock, then you shock.
And CPR is just to keep the blood flowing to the brain, right?
Yep.
It's not to get them
and organs
revitalized.
Yeah. So you do it to one, get blood to the brain and other organs.
Yeah.
And then to circulate the blood back to lungs. It's essentially you're pumping the heart that isn't pumping itself. And a lot of times you'll get the circulatory system back up, and then a lot of times people come back. I mean, CPR it's brutal. It breaks a lot of your ribs and stuff like that, and it's gonna hurt afterwards. But it's semi-successful as long as you start early enough and get adequate compressions. If somebody's been laying in their brain, hasn't had oxygen for a number of minutes or hours or whatever it might be, then it's not gonna be a good outcome. But
it's not likely they're coming back at that point.
But you always do it because you never know. So
yeah, true. So you guys have to give CPR quite a bit as a nurse?
Yeah.
In your section at least?
Yeah.
Yeah?
Yeah.
And a lot of those don't make it?
Just last week, yeah. Yep, last week a guy coded. He was pretty sick, and I think he wasn't my patient, but I think he had terminal cancer, so we didn't go for very long before the family said, all right, we're okay with stopping that for now, stopping that and letting him go, because it looks like it looks painful. It is painful. You do break a lot of bones. So
what kind of a role does the family play? I mean, let's say obviously if somebody's dying or if they coded, like you said, their heart stops, you have to try your hardest to save them, right?
Yes.
Is that what you guys were taught?
Yeah. So we have ACLS, which is advanced cardiac life support, I think is what it's for. Anyways, it's just ACLS. It's a protocol that everybody in the ICU is certified, and then it just lays it out for you. I mean, it's kind of like a little tree. If this is this, then you go this way. If it's this, then you go this way. So you start out and you start CPR. That's the first thing you do. You start CPR, and then you look at, do they have an airway, like a tube in or anything like that, or do they need somebody to have a mask on them? And then it tells you, the protocol tells you, when to give epi, when to give, certain other drugs. Everybody always knows epi, but it tells you if this is happening, then do this. If this is happening, then do this. And the cornerstone of it all is CPR.
So like I was saying, when the family gets involved, you said that they kind of stopped you. When can they come in and say we don't care anymore? He's gone.
At any point.
Or to tell you to keep going. Can they do that too?
They can make that person a full code to start the process of CPR in the first place. But once we get to the 30-40 minute mark, which we have before
30-40 minutes.
Yeah. Then
of CPR.
Yeah. Then the doctor will say this is futile and call time of death. But the family can stop it if that person who is able to make that decision, like a spouse or and a non-married person, whatever their next of kin is, adult children or something like that. If it's their person, that the DPOA that can make that decision, they can make it at any time. They could make it 1 minute after we started and be like, ooh, that looks painful. Let's just let them go peacefully.
Really?
Yeah.
Wow. They have actually quite a big role then if they wanted to.
Yeah, and sometimes it's good for them to see how we're trying to revive them instead of just kicking them out, because they might not see what kind of pain. If it's a 85-year-old grandma who gets all of her ribs crushed, and what kind of recovery is she looking at? A lot of pain, long time recovery, maybe never recovery.
Is that worth it? To squeeze out a couple more years maybe and just be bruised, and at that age you can't recover very well, right?
Yeah, so that's a decision that people have to make, and hopefully people have told their loved ones what they would like done, so that way, if they've told you, then it's not your decision anymore. So, like if my mom was like, I don't want to have CPR done on me, then I don't have to feel the burden of making that decision to make her a DNR.
Right.
Because she's already made that decision. So
Explain what DNR is for everybody.
do not resuscitate. So
that
you would never start CPR if your heart started going, started having VTAC or whatever. We would not do CPR on you.
So if you have a DNR, is that like an official document?
Yeah.
That says do not resuscitate?
Yeah. So like in the hospital, it can be like the patient can tell you or whoever the family.
So if it's just verbal, that's
just in the hospital setting, like, but it's typically a notarized form. Yeah.
But if I'm in the hospital and my nurse is in there and I'm like, hey, by the way, do not resuscitate me.
Yeah.
That's enough for you to.
Mm-hmm. Yep. We can put that order in. Talk to the doctor and put that order in.
What if it's a patient that you really don't like and you're the nurse and you're like, yeah, I swear he told me he told me not to do it.
Yeah, I don't think that's a very good thing to
do. Not very moral of you or anybody, I guess, for that matter.
That sounds like murder.
That does a little bit. It's on the fence whether or not that's murder, but
yeah.
You deal with patients probably that are like, God, some of them got to be just stupid or you don't like them or even mean to you probably.
Yeah, some of them, yeah.
Do you have patients that are just a pain in the ass that just don't give you the credit that you deserve for taking care of them?
Yeah.
Or even worse?
Yep, absolutely. Yep. Anywhere you go, anywhere you're a nurse, you're going to run into these people who...
That's got to be one of the worst aspects of being a nurse. If you're trying to save this person's life and they're being ignorant about it.
Yep, it's tough, but just kill them with kindness and... and move on to the next little old 85-year-old grandma who tells you thank you every 2 seconds.
Yeah.
So you gotta, it's not just nursing. You deal with people like that no matter what job you have, or just people who aren't thankful, and or a lot of times people who sometimes would put their self into the hospital and then act like that. That's a whole nother thing.
What do you mean put their self in the hospital?
Whatever it might be, if people who drank themselves to death or near death or whatever, and then they're just sour the whole time they're in there, or hurt themselves or whatever,
Mm-hmm.
My advice is just be thankful and say thank you, or try not to be too big of an asshole when you're in the hospital.
Do you have any specific stories about somebody that was treated you like a dick when you were taking care of them?
I had one guy who rode his bike into traffic and got hit and hurt his neck, and he could feel his, he could move his toes and everything, but it was probably going to be a while before he could feel his arms, or maybe never again, but he would just scream at me and tell me that I needed to do this and I needed to do that, and demanding and just to everybody, just mean to everybody, mean to all the girls I work with. Which on the opposite side of that, I will say there's some mean nurses to people who don't deserve it as well. So
being a nurse, though, you gotta kind of have thick skin for that stuff, right?
Yeah.
And you can't take it personally. If you're gonna be a nurse, you're going to deal with, it's not like customer service, but it is in the aspect that you're dealing with all sorts of different people that are in different situations in their life. And, you're going to have those ones that are just bad apples.
Yep. Yeah, you can't let it get to you. People are going to, you don't want to come down on somebody, and, especially in their time of need. And you have to think maybe that's why they're acting like this. Maybe they're good people outside of the hospital, and, they're in the hospital because they're sick, or their family members are sick, or whatever the case might be. And so just as long as it's within reason, it's not your job to go to work and get hit, by a patient or anything like that. And within reason, some people are just frustrated, and you got to take that into account. So
what do they do if somebody's violent?
We just call security. Yeah.
You guys have security that works at the hospital 24/7 for that reason?
Yeah.
Are they like cops or what?
They carry guns. I don't know if they're cops or if they're like off-duty cops. I think so. Like a lot of them are ex-military and stuff like that. But they're big guys, and they got guns. So and then they respond quick. It's we're less than.
That's a good thing to know. Yeah. That makes you feel a little more safe,
Yeah.
I guess, knowing that you have guys with guns that can run in at any second.
Yeah. So,
what's one of the craziest things you've learned about the human body being a nurse?
Ooh, that's a tough one.
Whether it be from an injury or just something
I think I guess maybe how resilient it is. I mean, people do crazy things to their body, or accidents happens, and crazy things happen to your body where you think, God, this person is gonna die.
How are they alive?
There's no way that this person can be alive. And then enough time, especially in a younger person. I mean, the body it wants to heal, and it can, against all odds. And people, you've seen it and heard about it all the time. It's amazing what the human body can do. That's probably the coolest thing.
Yeah.
A lot of times you just got to give it some time and let it heal itself. Sometimes there's not a whole lot medicine can do.
Mm-hmm.
So, but that's probably the craziest thing.
Yeah, I agree with you on that one. Just seeing stories, and I've read several stories too, where somebody survives against all odds, and you just think, how in the world? Or especially somebody that that's like famous, that's been a drug addict their whole life, or just abused the shit out of themselves. Ozzy Osbourne. He's not a human though. That doesn't count. He's a Martian.
Yeah. Yeah, and then you see people who, you hear about people who, especially like, my cousin, just, I guess, my dad told me this, that her husband died. He's like 30 or 31 or something. He was drinking and like liver failure and everything, and that was the end of it. And then you see these people who, you see people come in who are 75 and they drink, fifth of whiskey a day or more, sometimes even more than that. And they're just, they're still alive.
Just kicking it.
So it's not I don't think it's a good measuring tool to measure you against somebody else, because the bodies are so much different.
I think they call that survivor's bias. When, you always know that guy who's like chain smoking, and he's like, oh, my grandpa lived to be 80 years old and he smoked a pack a day since 1930.
Yeah.
I mean, okay.
Yeah. Well,
that's true.
You're not your grandpa.
But there's also hundreds of thousands that have died from smoking.
Yeah. Yeah, it's best just to maybe not go down and
do whatever you want, I guess, but just know the risks and don't be shocked when something does happen.
Yeah, absolutely, yeah.
Drinking alcohol obviously isn't the best health choice you could make, but we know the risks and we know how to manage it and keep it in moderation at times.
Absolutely. Absolutely.
All things in moderation, though, including moderation.
Yeah. Yep. Sometimes
you need to come on a podcast and smoke down however many Coronas.
I think we'll do all right with these ones.
I think that'll be plenty. Hopefully.
Yeah.
Hopefully. Otherwise, I'll have to push my beer button over here.
Amy?
Something I've always kind of wondered, and I know the answer, I think, already, but I want to hear it from you, is do you have to wipe a lot of people's asses as a nurse?
Every day.
Every single day?
Yep, every day.
You wipe shit off of their ass.
Yeah, so would you rather them just sit and shit? Would that be good for their health?
No, I'd rather just not be there to do it.
Somebody's got to do it.
I know somebody has to, and God bless you for doing that.
Yep.
But that doesn't bother you.
Yeah. No, it really doesn't. Throw up would be, that's a little bit more.
You think throw up is worse than shit?
Yeah.
I don't know, man.
Maybe it's just me. But
vomit is just
spit and stuff coming out of people's nose and mouth. I've gotten vomit on. I've gotten shit on. Sometimes you always kind of have the little pad ready to go, because if somebody starts having a little gas when you turn them, they could erupt at any second. So you don't want to be in the line of fire. You always stand kind of with their back and everything pointing kind of over beside you, because it'll happen. So,
well, that
and then if you want to get. If it's not too much information,
I don't think anything is at this point.
There's unfortunately people with spinal injuries who, the certain level of their body that they can't feel anymore. And right now, actually, I have an orientee at work that I'm training, and we had a patient that had a spinal injury, and we had digital stimulation is what we call it. It's a really nice word for you get 2 gloves on, always put 2 on, and then you kind of go in with your finger into the rectum, and you kind of touch the outside wall of the colon on all sides to kind of stimulate those nerves to have a bowel movement, because there's to a certain point there's no more communication from the central nervous system anymore. And it works.
A finger up the boot,
and you just kind of stimulate the bowel. Yeah,
that will stimulate it enough to make them take a poop.
Yep.
Did you know that was part of the job when you signed up?
I did not. I was surprised.
But it didn't bother you?
Yeah. So I mean, it's not something I want to do.
You've had your fingers in a lot of booty holes.
No, it's not a lot.
No,
It's not a lot. And you always try to use it as a learning opportunity for somebody else whenever that has to be done on your patient.
Have you ever seen a nurse or trained a nurse that is just like, nope, and they quit? They're done?
No, but last week a girl's glove broke.
Oh.
So
double glove.
She didn't double glove.
Double glove.
That's a cardinal rule when doing digital stimulation. Is
it really?
Glove. Yeah, cardinal rule. Double glove.
Man,
don't want to be caught with a poopy finger.
Man, I don't even know what to say.
These are the parts of nursing people don't talk about.
I'm gonna feel dirty just sticking this lime into my beer now.
Do you want me to shake it up for you?
Yeah. Stimulate that lime in there.
Yeah, that's part of the job. That's one aspect of it. Luckily, not very common. So
yeah, somebody's got to do it though. You got to have people willing to do it.
Yep,
you're that guy.
Yep, I'm that guy. Lucky me.
It does take a certain kind of person though, don't you think, to be a nurse? Then dealing with all of this stuff you're describing.
Yeah, I think my mom's a nurse, my older sister's a nurse, my younger sister's a nurse, and my youngest sister is in nursing school.
Oh my gosh!
So, it makes it talking to people who know what you're going through makes it easier. And it's my dad and my oldest sister, not in the nursing field, but the other 5 of us are, and it gets to a point where they just kind of walk away at dinner.
When you get into these, why do you? Oh, you talk about that stuff?
No, we don't talk about the dig stim, but anything nursing, they don't know the lingo and everything, so they'll quickly point out that we're talking shop at the table, and they don't like it.
He's like, got a pile of beans here, talking about sticking your finger in somebody's rectum.
Yeah. So my dad will be like, "Did you watch that episode of 60 Minutes the other day?"
Anyways,
but yeah, it makes it easier when you.
So you have a family full of nurses almost, and one in nursing school. What's nursing school like?
Depends on. There's a lot of different ways to go about nursing. You can do like an LPN, which is a licensed practical nurse, which they can't do all that an RN can do. Typically, they work in the long-term care setting. Mm-hmm. And then I think that's maybe that's
more of like a nursing home type nurse.
Yeah, I think I don't know what the school is exactly for that. It's not an associate's degree. It's not a bachelor's degree. It's more like I think maybe a year and a half or something like that. And then there's an associate's degree, which is 2-year degree.
So if you want to go that route, it only takes like a year and a half to get through your schooling.
Yeah.
You want to be like a long-term healthcare nurse? Or?
Yeah, and you can like bridge from LPN to RN. There's programs out there that do that. So.
Okay. So that's just a stepping stone then if you wanted to make a career. Maybe you want to do that for a little bit.
Yeah.
Then go back to school.
Yeah, and especially for people, single parents, single moms, single dads with kids, it might be a better option because you could work a little bit more through the rest of your school. For me, just went straight for a bachelor's degree, so 4-year degree, and it's 2 years of prereqs and 2 years of nursing school is what a bachelor's, and that's the one that I can definitively say how it works because I've done it. Mm-hmm. I know there's an associate's degree RN, which you're still a registered nurse. You take the same standardized test as a bachelor's RN. The difference is you don't get as much into the theory and the history of how nursing started and the research side of things. Okay. But you learn all the same tasks and everything like that. You get paid the same. At least at the hospital I work at, you get paid the same.
Really? Just for going in for an associate's?
Yeah.
So if people want to skip, first of all, did you know about that route before you went to, why did you not go that route?
Because there's so many different things you can do with nursing, right? So you can go to get your master's, you can teach, you can be a nurse practitioner, you can do CRNA, you can do anything. But if you wanted to do any of that, you'd have to first get your bachelor's degree then, and then you could go back to school to do your master's or doctorate.
So if you just go for that associate's and you become a nurse, making the same pay as somebody like you who's gone through the bachelor's, you don't have the opportunities to go forward. Yeah. From there, if you want to advance, you
have to first go back to get your bachelor's, and then you can go back to get Okay.
So if you think you'll have any plans of going on further in the future, you should probably just go for that bachelor's.
Yeah, I mean, if you have, there's money attached to it too. If you can afford to do it, I think I would recommend that for anybody.
Yeah. But
I understand. I know a lot of good nurses that are just associates, degree nurses. But I also know a lot of nurses that have or had their associate's degree, and then they've had to go back to online school or whatever it might be to get their bachelor's to continue to go on.
Mm-hmm.
So I think while you're young and you never tasted the fruits of your labor in the workforce, you might as well just get as much school done as you can.
Yeah, if you have the means to do it.
Yeah,
if you're able to. A lot of people though might just be perfectly content with sticking that 2-year degree out and staying a registered nurse forever.
Yep.
Yep. And that's fine too. I guess you probably ought to need to know your goals before you.
Hopefully you got a good back because the patients aren't getting any lighter.
That's something I didn't think about. You're picking up people all the time, aren't you, as a nurse?
Yep, moving them, sliding them around.
So being fit is an advantage for sure. I mean, it's an advantage in every field, I'm assuming. But
me.
Unless you're a sumo wrestler.
I have to drink these Corona Premiers to keep my figure,
Yeah, and you are keeping that figure, believe me.
Yep.
90 cals.
Yeah.
Oh,
after you have 15 of them, it adds up, I guess. But
yeah, but you can drink 15 because it's 90 cals.
Exactly.
Versus
it's healthy.
It's healthy. Yeah. It's a health food.
Yeah, it's superfood.
Number 1 nurse recommended beer in the nation, Corona Premier.
Or Michelob,
or
there's any of the premium light beers out there.
Yeah.
So, but yes, patients are. I mean, that's not just evident in the nursing world, but I mean, people aren't getting any lighter. That's for sure. So.
No, actually, they're getting heavier.
Yeah.
If you look at the data.
Yeah, and so that's another reason people. I mean, you don't want to. By the time you're 60, I mean, you can't retire yet at 60. You want 65 or whatever it is, 65 and a half or whatever, however it is works at your job. But as a nurse, when you're lugging people around, especially bigger people, at 60, I don't want to be doing that at 60, 58.
That's a good point.
So that gives you a little bit of a drive to get that bachelor's degree, and then maybe potentially go on to do something else.
So people obviously then that probably are close to retirement age that just stayed RNs their entire career.
Yeah.
So, do they struggle with that at all? Or?
And in a lot of times, I know some people who still work at the bedside. That's not as common. A lot of times people kind of work into management roles or into risk management or education roles or there's just so many different things you can do as a nurse.
A lot of opportunities if you want to go the nursing route.
Yeah.
You have a supervisor then too, right? That's your boss on your shift.
Yeah.
Are they just an RN?
So we have a charge nurse who's same. They're just a nurse like us. Then our manager is a nurse. All of our managers are nurses too.
They have the same credentials as you, basically.
Yeah,
in terms of schooling and.
Yep, they're registered nurses. Then our directors are registered nurses. Our chief nursing officer, our CNO, which is the head of the nurses in the hospital. She's a nurse. Just like everybody else.
So if you want to stay in RN, these are all pathways you can go?
Yeah, or you can go back to school, be a nurse practitioner. You can.
What's a nurse practitioner?
You have a little more autonomy. You work with a doctor. I think in the state of Kansas you can actually work just by yourself. It differs state to state. But you can essentially instead of just a nurse, you're a provider at that point. You can write scripts. You can do practice at least a limited scope.
Mm-hmm.
And do things as a doctor would. So and then you can do nurse and anesthesia, which a couple of my family members do, where you run anesthesia.
That's all you do basically.
Mm-hmm. Yeah. Yep. Run anesthesia. Yep,
you have to go on more schooling for that.
Yep. So my mom and my sister both have master's degrees for that, but it's all changing to a doctorate degree. So
really.
Yep.
So if you want to be, what's their title? Anesthesiologist?
Nurse anesthetist.
Nurse anesthetist?
Yep. Nurse anesthetist.
Anesthetist?
Anesthetists. Depends on who you ask.
These are some hard words to pronounce.
Yeah. Anesthesia is a tough one when you try to change it a little bit.
And it's one of those words where if you think about it, It doesn't sound right if you say it a bunch of times.
Yeah, it doesn't.
You know? So they're making that 4 more years after your bachelor's now.
So there's a few things that you have to have, but before you go to school or apply for school, but experience obviously being one. You can't just go and keep going to school and be a nurse anesthetist or a nurse practitioner. You have to have experience.
Okay.
So it's 2 years, 2-year program as a master's, and it's a 3-year program as a doctorate. So most programs are changing, within the next couple of years. Obviously, COVID kind of stopped everything a little bit, but they're changing in the direction of doctorate, and that's true with a lot of things. I think not just in the medical field. I feel like you just need more education and separate yourself. Make yourself more marketable. Anyways.
Mm-hmm. Did you ever have any desire to be a doctor?
No, not really. Just because of all the school.
It's a long time, isn't it?
Yeah.
It's pretty rough too, huh?
And looking back, maybe I should have just done that, and you could be the top dog. But still, I just turned 25, and I'd be in school still. I mean.
Yeah. My sister's a doctor, and I don't think she actually got out on her own until she was like 30 years old or around that age. I mean, it's a lot.
But and it's you reap the benefits of it then.
Yeah,
so.
Yeah, you do. You're getting that doctor pay.
Yeah.
But it's crazy. But there are still great paying options in the nursing world, you're saying.
Yeah.
Outside of being a doctor.
Yeah, and even just as a bachelor's degree, I mean, you can move around. I'm not at the highest paid, RN position.
Right.
But I'm in the trauma surgical ICU because it's a good stepping stone. It's good experience if you want to go on. Really to anything that's past just a regular nurse. So.
Can you go on to be a doctor if you're a nurse? Or do you...
You can go back to med school and become a doctor, yeah.
So if you get a bachelor's of nursing, 4 years of school, you work that for a while, can you go to med school straight from there?
You might have to take like a few classes, but yeah, you can go back. There's a surgery resident right now that was a nurse in the same unit that I work in. And some of the people who have been there for a while, they remember her, and she went back to med school, and now she's going through her surgery residency. So it's absolutely possible. It's a longer way to go around, but
but it's doable.
Yeah.
If somebody came up to you that was young and said, "I want to be a nurse," or "I want to be in the healthcare industry," what would you recommend them doing?
I would say to start out, anybody that I think you can just be 16 years old to be a CNA. Go and start a CNA, a certified nurse assistant. It's, who you see at the care home or, there's in the hospitals and everything too.
How do you do that at 16 years old? In high school?
Yeah, you can do it in high school. You just got to get like it's like a little certification, like an 8-week course or something like that. Or they offer it in some high schools. I know my little sister got hers through high school. They started doing that. But
so you would recommend doing that first?
I think, and I wouldn't say that that's how it is because you're doing really like the most the physical labor part of things, and you're really on the ground with the patient, helping them get up and taking them to the bathroom and doing showers and stuff like that. But I think that if you can do that, you can move up after that. So so
don't be scared.
Yeah, if you can do that at a care home, which are generally understaffed, and you do all right at that, then it's just going to get better. It's good, and it's not worse as a nurse than it is as a CNA. You have more responsibility on the other things, but as far as like the cleaning of
fecal matter,
yeah, and stuff like that, you get a good taste of that if you can handle it or not at as early as 16. So I think that's what my mom told me to do. That's what I did, and it worked out. So
yeah. I think they actually did offer that CNA course when I was in high school too.
Yeah.
And I think I stepped my toe in that water, and I was like,
Yeah.
I'm not.
Don't have to do anything with computers. Just
no.
Clean the screen.
So they shouldn't be afraid then. Not afraid, but they shouldn't be scared that that's going to be their work life, their entire career, just going through CNA school or CNA certification.
And people do that for their life, and you can certainly do that your whole life. But if you get into that and realize that you don't like to, take care of people like that, in the most
If you put on one of those
bottom level
gloves
sense,
and they say, "Hey, we need some stimulation in this orifice,"
yep.
and you go running, you better not stay a nurse.
Or maybe go to like do a doctor's office nurse. Maybe you shouldn't have to do that probably, but in an ICU where you're talking more total care on your patients, you're gonna have to do things like that. So I mean, you could be a school nurse and you don't have to stick your finger.
That's a good point. Being a school nurse.
I mean, you could do.
Forgot about those.
I know people who have nurses for insurance companies who, look at help do their like the reviews on medical bills. I mean, you can do home health. You can do dialysis where you run the dialysis machine. You don't actually like have to, wipe any butts or anything like that. I mean, you can do.
So these are all like little subcategories. You can
be
go.
Office nurse, and you can.
There's all sorts of opportunities. You're not going to be in trauma like you necessarily, or even in a hospital.
Yeah. I mean, you can.
So it's a good route.
Yeah, and
you would recommend it.
A couple of years ago, they came up with this nursing compact, where 28 states got together, and you can get this nursing compact license, where you can go and be in any of these states that are in this compact. You don't have to get relicensed. So, like if you're gonna be like even people, like a hairdresser is licensed in the state of Kansas. I mean, you go to their thing, you see their license right there, and doctors are licensed, lawyers are licensed. There's a lot of jobs that are licensed by states, and as a nurse in this compact, you get one license, and it works in 28 states right now is what it is at, I think. So you can go and you don't have to that can be like a 6 weeks process. You don't take the test every time you do it.
So that's a huge factor being.
But I mean that's something that is you can go to different states and cities seamlessly, and there's always jobs open as a nurse. I mean,
that's something cool about nursing is that unlike some industries out there, you have the tech giants that are on the coast for the most part in big cities. You have farming in the Midwest. I mean, everything kind of has its own regions for the most part, but nursing is everywhere in the world.
Yep.
Everywhere in the nation, every city, there's always going to be nurses. And that brings me to another point, that your job isn't going away ever.
No.
It's a safe route, don't you think?
Yeah, absolutely. It's job security for sure. I mean, you could argue as people get heavier, or how I said it, people aren't getting any lighter. Well, people aren't getting any healthier either. That's for sure. So, and people are living longer.
They're drinking Coronas, not Corona Premiers.
Yeah, they need to get on the Corona Premier.
But you don't want them to, because then you won't have a job. You need.
Well, the thing is that if anybody lives long enough, something's gonna start going wrong.
Yeah.
And then as long as there's advances and things are only getting better, medical advances, but as long as people can do something to help you live longer, other people are going to want it. So
you're recommending the nursing field, or even the healthcare field as a whole, to somebody that's asking for advice. If somebody's on the fence and leaning, like, I don't know, Jared, I think that I really would like to be a nurse, or I think I could do it. You're like, hell yeah.
Yeah.
Go for it.
Yeah. I know people who haven't made it, which is fine.
Yeah.
But I think that it's a good option. I mean, healthcare you've seen all the fuss about healthcare and how much, anything around healthcare or anything like that costs, or whatever it is, which, people think that the nurses make that money. I'll tell you right now that just because you pay $150 for your prescription doesn't mean I'm making any more money.
Well, you're not making the prices.
Yeah.
It's not like you have an asshole patient that's, throwing stuff at you, and you're like, oh, your medication just went up $100, buddy.
But yeah, but it's going to be around. It's going to be around whether, no matter what happens with how you provide healthcare, per se to the country, you're still going to need nurses, at least for, at least the next 50 years or so.
Yeah.
I think
Politics all aside, you're going to need people working as a nurse always and forever.
Yep.
Unless something crazy happens and we morph with AI machines.
Yeah. Then you could just put you on
and you can just
Ford's assembly line.
then it's going to be IT people taking over, not nurses.
I don't have to go. I'll have to go back to you to get some pointers.
Are there any misconceptions about nurses that drive you crazy that you hear?
God, most of them are true, probably. I don't know.
Kind of like a lot of stereotypes. They're sort of true.
Yeah, I mean, I don't.
Let me ask you this: you're a male nurse,
Mm-hmm.
and you're a bigger male nurse with a beard. You're taller. I mean, is that something that people get mixed up with? And I'm not saying like get mixed up in a sense that. I guess what I'm trying to say is, do people mistake you for being a doctor? Do people
Yes.
look at you and say, "You're not a nurse. You're not a girl"?
Yeah, some people. Which there's more. There's quite a few male nurses now, but definitely more female nurses for sure.
Yeah.
Probably most everywhere you go. I mean, I don't understand how I wouldn't. At least not yet. But people, they mistake me for doctor. But
It's just kind of the biases of the old world that flow over,
Or
my sister I mentioned earlier, she's a doctor, and she gets all the time, especially older men who are like, "You're not a doctor,"
Yeah,
because she's like a short girl,
And that's funny because
woman.
older ladies kind of say to me like, "Oh, good for you we need more male nurses."
Really?
Same as older men would be like, "You're not a doctor."
That's just because the older ladies want to look at you and not some young chick.
Well, no, but the older ladies do love me, but that's just because I butter them up, So, and those old ladies are tough. You come in, I got an old lady who fell and smacked her head and broke 10 ribs and her hip, and she wants a Tylenol. 2 Tylenol.
That's it.
It solves everything. Since the 40s, 2 Tylenol solved everything. Then you get a young male who's in a car wreck or whatever it might be, our age, in their mid 20s or whatever, even up to pretty much anything up to like 35, 40, they break 2 ribs in an accident, and they need the most payments, and it's just the most excruciating thing.
Yeah, pump me full of drugs.
It's like they're screaming, and your other patient's a 90-year-old lady with twice the ribs broken, and she wants a Tylenol because she doesn't want to get addicted to
that
opiates.
Old school mentality, man.
Yeah.
Those people are tough.
Yeah,
they've been through some shit.
It's that generation,
yeah.
But anyways, you see all kinds of people.
Yeah.
I mean, people from every walks of life, every end of the spectrum. People are always in accidents. People are always getting sick. There's no socioeconomic qualifier for coming to the hospital.
Right.
Yeah. So.
Very cool. So, you'd recommend it? You'd do it over again if you could?
Yep, I would do it over again. I recommend it. It's not for everybody, and it's tough at times, and so you gotta stick with it and make sure you gotta
be mentally strong,
good people around you,
yeah,
at home and stuff. But
having people to talk to,
yeah.
Not a podcaster, maybe, but
yeah.
If I was a nurse, this would be a great podcast. You guys could go on for hours.
Yeah.
Right.
Yeah, we could go on for hours as long as we don't release any details.
Yeah, that's not allowed.
If that was
details about the person.
Yeah. Yep. If that wasn't the case, it could be much more interesting. But HIPAA is a serious thing. So
yeah. Alrighty. Well, Jared, thank you for coming on, buddy. It's been a pleasure, and thank you for all you do for the world, for all the people getting taken care of out there. You're in that group, man. You're a first responder, sort of.
Not really.
Maybe like a second responder. But you're taking care of people at their worst, and for that we're thankful. So, cheers.
Cheers.
And thanks for coming on.
Thanks for having me.